Hello, everyone, and welcome back to Black Mental Health Matters. I'm Dr. Kerry-Ann Williams. I'm a psychiatrist practicing here in Massachusetts, and this is a talk show that's about everything related to mental wellness in the Black community and beyond. And today I'm going to be speaking about ADHD in children. Now, in the Black community and beyond, sometimes our children have problematic behaviors. There are so many reasons that children can have problematic behaviors. Sometimes it's something internal. They're hungry, they're tired, they're jealous. Sometimes they're experiencing physical issues like pain or discomfort that they can't really communicate that very well, so they begin to behave poorly. Sometimes they're just naturally immature for their age, so they get chastised for not behaving in an age appropriate way. Other times, it's because of difficulty with problem solving. That is, when they're presented with an issue that they can't figure out how to navigate, they start to act up. For example, a child who's in a classroom that's having learning problems may not know how to communicate that they need help, or they may not be feeling listened to when they did ask for help. And so they start acting up and distracting other people. In another example, a child may have an argument with another child, but they don't know how to navigate normal disagreements. So they decide to hit the other child because they're having trouble figuring out how to problem solve the situation without just acting up and hitting people. Um, Today, I want to talk about ADHD because ADHD is one of the most common reasons that children have problematic behaviors. And a lot of times in the Black community, people they don't believe that their child has ADHD. They think they're just behaving badly and that they should, know better. You guys have heard that phrase, right? They should know better, and that's true. They should know better, but sometimes it is a medical condition that's making it more difficult for them to make those good choices. So you're partially right. They should know better. But sometimes there's something really important making it very difficult for them to make that choice. And when it's missed, there are consequences to having it undiagnosed and untreated. So, what is ADHD? ADHD is attention deficit hyperactivity disorder. And a lot of times people say, well, they kind of distinguish ADD from ADHD because they say, well, the hyperactivity part may not be there. The truth is that with the most recent designation, ADHD is just called ADHD no matter what the situation is, but they'll categorize it as ADHD inattentive type, ADHD hyperactive type, ADHD combined type, and there's ADHD unspecified type. And so rather than just saying ADD, they'll say ADHD inattentive type. It's a very subtle, kind of subtle difference, but you'll hear psychiatrists still use ADHD even if you or your child doesn't actually have a main point of hyperactivity. But I'm going to go over some of that a little bit later. But ADHD is what psychiatrists call a neurodevelopmental disorder. It's a neurodevelopmental disorder. So neuro is for the brain and the nervous system. So neurodevelopmental is how the brain and the nervous system affects the psychological development of the child. What I've come to realize is that, so as a trained psychiatrist, I know about ADHD. I know it's a neurodevelopmental disorder. I know it's real, but I've realized that some folks in the Black community don't believe that ADHD is a real diagnosis. They think it's kind of just a label that people try to put on their children. But what we know from studying brain development is that there is a biological basis for how this happens. So think about it this way. The brain has a process for how it develops from the time that a child is in the womb till the time they're born and so on. And then different parts of the brain grow at different rates and at different times. And so when, with a small baby, first we see a lot of just automatic functions like sleeping, eating, breathing. And we see some basic emotions, anger, fear, joy. But one of the last things to develop is this section at the frontal part of the brain. It's one of the last things to develop. And it is all the mental skills that we need to learn and to make good choices. Okay. So the last thing to develop are the things that we need to learn and to make good choices. Um, and so it doesn't really fully develop until age 25. And so all of these skills that we're so desperate for our children to develop, how to control their impulses, how to understand social situations, how to have self-reflection and to solve problems, it is actually the slowest thing to develop. And it's very subject to things like stress and anxiety and tiredness. It kind of starts to, become a little bit weaker. So the more that you yell at them, the less efficient they become. Because when people are stressed, that front part of their brain kind of starts to feel stressed out and it doesn't work as efficiently. So it's a challenge to be sure. So, of course, children, it's not that they have no skills in that area, but it's that their skills are weak. And there's a certain expectation we have for how it's going to evolve and develop over time, what we call normative development. And then we have some kids that veer off from what we would consider to be average development compared to a very large group of same aged peers. So when kids are very young, we expect them to be very bad at these skills. We call them executive functioning skills. And so um, by bringing them to a specialist in child development, they will know the right questions to ask to try to discern whether this is kind of expected in child development or whether this is unexpected in child development. So that's kind of how you're going to be able to tell. It's really hard to tell without meeting with a specialist. So let's talk a little bit about the two parts of ADHD, the inattention and the hyperactivity slash impulsivity. I'm going to start off actually with the hyperactivity slash impulsivity part of ADHD because hyperactivity is the attention getter. Okay. This is what tends to bring kids to the attention of teachers and administrators and parents, and eventually to doctors and so on. It's disruptive. Hyperactivity and impulsivity is disruptive to peers, is disruptive to teachers, is disruptive at home with parents. And so many children with ADHD have this subset, this hyperactivity slash impulsivity subset. And they have this need for stimulation. It's hard for them to be still. They don't like being bored. The part of their brain that kind of controls attention and impulsivity, it's often slightly underdeveloped, slightly underactive. So they need this stimulation. They don't want to wait for anything. They don't want to wait in line. They want to go now. They don't want to wait for their turn. They want to play now. They don't want to wait for the teacher to call on them. If they think they know the answer, they're just going to blurt it out loud before anybody else has a chance. And sometimes when they're interacting with their peers, they just interrupt and talk over their peers. And sometimes this can push their peers away. So think about it. If you're a kid and you're playing with someone and that person has a lot of energy and they don't want to wait their turn when they're playing games with you, and they are more interested in talking over you and telling you what to do than they are with listening and collaborating. They're not really great at being patient and listening and collaborating. You may eventually want to avoid playing with that peer because it's not fun anymore. They don't allow you to do your things. And so kids with ADHD, usually they do have friends. Usually they have friends, but occasionally they can really alienate them because they may have difficulty with problem solving social situations and they just have so much energy and they're very impatient and impulsive. And sometimes they get other kids in trouble because they get in trouble and then everybody in the friend group gets in trouble at the same time. And they think, oh, when I'm with this kid, I'm always getting in trouble. So sometimes that can push peers away too. It's also problematic, this hyperactivity and impulsivity is also problematic at home when the parent asks their child to wait for something, but they don't want to wait. So they lie and they try to sneak and they do it anyways, right? That can be really frustrating for parents. And in fact, lying is something that many kids with ADHD do. Not all, but many kids with ADHD end up in this rut where they lie a lot. And the thing is that kids with impulsivity, they're constantly doing things that they're not supposed to be doing. They're constantly doing things that they're not supposed to be doing. They're constantly getting in trouble. So lying tends to be the strategy that they rely on. Even when it's obvious to everyone else that they're lying, they keep lying. They can't problem solve a better solution. Um, so if you have a kid that's impulsive to the point where they're constantly getting in trouble because they just can't stop themselves, they might have ADHD. You might want to bring them to meet with a specialist in child development. Okay, so here's another thing about ADHD. Remember I said earlier that some people, they just kind of don't believe that ADHD exists. They kind of just feel like it's a label that people give them. Um, you know, they'll hear this whole thing about impulsivity and they'll say, "No, it's not ADHD." Okay. In fact, there are some folks that will just feel like it's an American diagnosis, you know. So sometimes people move to this country and the folks are telling them, "I think your child has ADHD," and they'll say, "No, no, no. ADHD, that doesn't exist in my home country. You know, don't try to put your American diagnoses on my kid." But here's the thing, ADHD is not bound to the US, right? Mental health care varies from country to country. And in the US, mental health care is quite advanced. You know, there's a lot of emphasis on developing mental health care and providing mental health education. But in some other countries, mental health care is not something that's spoken about as much. There might be less knowledge in the general public. It's not prioritized in the same way. So it's not that certain diagnoses don't exist in other countries, but rather that it's not spoken about. It's not identified routinely. It's not commonly treated. And so this can lead you, you know, this kind of thing can lead you to feel like the diagnosis is like culturally bound, but it's not. Um, and so the unfortunate effect of this is that when people see children displaying that hyperactivity and impulsivity of ADHD, sometimes they blame the parents and they think, well, you're just not a good enough parent because your child is acting so poorly, because they don't feel like it could be something biological. They end up blaming the parents. The other thing is they may blame the child, kind of attributing it to some kind of inherently bad qualities within the child. Well, that's just a bad kid. That's a bad behaving kid. Again, not really appreciating that this child may be trying their best. They may actually be doing everything they can, but they just can't stop themselves. And that this is something that could be helped with proper diagnosis and treatment. So, talking down to those kids, shaming them, that actually makes everything worse. And it makes those children feel less effective, especially when they're trying their best. Okay, so now let me go to the second part of ADHD. I talked about hyperactivity and impulsivity. Now I'm going to talk about inattention. Inattention is a little bit tricky because, you know, this is where the kids don't have the same level of impulsivity. And when a child does not have outwardly disruptive behaviors, it can take a longer time to realize that something is wrong. Um, and when kids are smart, they can sometimes compensate for the inattention. So then again, it takes a longer time for you to realize that something is wrong. The other thing that I'll just kind of throw in is that inattention is not a diagnosis. Inattention is a symptom. So people with ADHD have inattention, but a lot of inattention can go along with a lot of things. People that have depression can have inattention. People with anxiety can have inattention. People with trauma can have inattention. People who have insomnia, they're not getting enough sleep, they can have inattention too. So there's a lot of things that can cause inattention. So again, this is where a specialist would be helpful for discerning like what is the cause of this inattention. But in any case, today I'm talking about ADHD. So this is the inattention related to ADHD. So as I mentioned, when kids are really smart, sometimes they can compensate for the inattention. So it takes a longer time to pick it up. And what's going on is that these kids are spending a longer time doing the work. So sometimes they're actually rereading the paragraph multiple times to get it. Um, or they're spending twice as long on their homework as their peers are spending. And they're disorganized. Their backpack is a mess. Their room is a mess. Parents are always yelling at them to get their room clean. But the part of the brain that is responsible for categorizing and sorting things and organizing things is underactive because they have ADHD. So sometimes it's not laziness, sometimes it's overwhelm. And again, trying to figure out the difference because sometimes kids can be lazy, but sometimes it is overwhelmed, like not knowing where to start to keep things tidy. That could be ADHD. Now, again, with inattention, they may not be disruptive, but they may be a chronic procrastinator. So this is because they can't really organize their time well. They can't really organize their schedule well. They can't keep track of things. And so, because they can't gauge how much time they're going to need to complete a task, they sometimes under budget the amount of time they need and end up stressed out because they've only given themselves 20 minutes to complete something that is actually going to need an hour. Or if the task isn't interesting, they choose to do something else that's more stimulating first. And then somewhere at 11 p.m., they finally have this overdrive that they have to complete this essay that's due tomorrow that they should have started at 3 o'clock this afternoon, but they waited until 11 p.m. to start the essay. And they have this burst of adrenaline to get this essay done. And again, if they're really smart, they can barrel through and do that essay at 11 p.m. and still get an A. But that strategy will only work for as long as it works, right? Eventually, they get to a point where starting their homework at 11 p.m. doesn't work anymore. And their grades start dropping and everything starts falling apart. And parents are confused because the grades were good up until this point and suddenly they're bad and they don't know why. And suddenly, with more kind of like assessment and attention, we realize that this child or teenager was exerting so much effort into doing their schoolwork. They were taking twice the amount of effort to do the same amount of work, and it was unsustainable. It was unsustainable to be putting that much effort in. They were really trying to compensate for the untreated ADHD. I want to mention something here as I talk about ADHD and kids working twice as hard to do the same amount of work and that sort of thing. Because I know we live in a society where sometimes people really, and especially in America, it's very highly valued to work hard, to burn the midnight oil. And so I can see the temptation to see this as a positive thing that kids are putting a lot of effort in. However, if they're putting effort in for what's essentially a neurodevelopmental disorder that has a known treatment, what we and I'll talk a little bit more about the idea of what happens when ADHD is undiagnosed, is that it's not risk-free to kind of let your child have untreated ADHD. Right. So sometimes parents feel that maybe it's healthier for their child to use like life strategies to compensate for the issues that ADHD causes. And it can be helpful and necessary for them to use life strategies, but it's just not enough. And because of the fear of psychiatric medications, because of the fear that psych meds are bad for you, sometimes people tend to avoid them. And the issue is that psychiatric medications are not simply just good versus bad. It's not as simple as good versus bad. And of all the meds that we use in psychiatry, ADHD medications are probably some of the most straightforward. Um, and sometimes people don't even have to take them every day, depending on what you discuss with your doctor. Um, and it also doesn't go away necessarily. We used to think that it was like 50-50, that, if people had childhood ADHD, that 50% of them would go on to continue in adulthood. And we've realized now that it's actually much, much higher number than 50% that continue to go on into adulthood with ADHD. And I don't even want to talk too much about adult ADHD because that's kind of a tangent. But sometimes, if in childhood your child isn't properly diagnosed and treated, they go into adulthood with undiagnosed and untreated ADHD. And it is much more difficult to get diagnosed and treated as an adult. Okay, ADHD is a diagnosis that starts in childhood. So a lot of times when you go to see an adult psychiatrist, they're going to be skeptical. They're going to say, well, if you truly have ADHD, why wasn't it diagnosed and treated in childhood? Okay. So people are sometimes less likely to diagnose it or treat it when you're an adult because they're skeptical about why it wasn't identified in childhood, like what happened. So that's one of the reasons why it's important to like do it now, when your child is younger. The other thing is that untreated ADHD can lead to a lot of issues, one of which is substance abuse, which of course every parent thinks their child will never get into. But children, poor decision making and are impulsive, are very prone to experimenting with drugs, and drugs are everywhere. Okay. And children who have an untreated mental health condition like ADHD are more likely to continue using substances because it makes them feel better, because they're not receiving the proper medication to help them, so they're self-medicating. The issue is that some of the medications, not all, but some of the medications that are used to treat ADHD are medications that can be diverted and misused out on the streets. So people will prescribe them only under certain conditions. And now for children, psychiatrists are likely to still prescribe even if they have some light substance use, because they need it for school, and they know that if they don't prescribe it, they're more likely to get into more substance use. So sometimes they'll still prescribe if there's very light substance use. But for adults, if you have substance use and ADHD, it becomes much less likely that an adult psychiatrist is going to be comfortable prescribing a medication that has a potential to be misused for you. So again, not all ADHD medications have the potential to be diverted and misused on the streets, but some of the ones that work the best, the most effective ones, people can sell them on the streets and things like that. So people are very reluctant to prescribe them sometimes. But that's just, kind of a lower percentage. For most of our kids that we treat, they're being used responsibly by parents and by kids. So there's not really a problem about it being diverted to the streets or being misused. It's just being used for what it's intended for. And let me know if you have any questions about ADHD medication, because I'm not going to get into the medications here. If you feel like your child has ADHD, the best course of action is actually for you to meet directly with a provider and ask them your questions, and to find out more about medications and treatment options and that sort of thing. I really am, this particular podcast is more about increasing awareness about what ADHD looks like and when you may need to bring your child to see somebody. So basically, as I was mentioning, if your child is appropriately diagnosed and treated in childhood, it reduces the risks associated with untreated ADHD, like substance use, and it makes it more likely that they can continue to receive appropriate treatment into adulthood, because people they'll have a record of treatment in childhood. So adult psychiatrists would be more likely to continue their treatment. All right. Now, in the remaining time, I want to talk about the fact that sometimes there is a problem with behavior and with attention, hyperactivity, and impulsivity, but it's not ADHD. And that's part of what a specialist does is that when you come to see the specialist, we kind of parcel everything out and say, okay, is this ADHD or is this something else? Is this normal child development? That sort of thing. So, for example, if your child has a learning problem, like maybe they have a math disability or they have a reading problem that maybe we didn't know they had, they may stop paying attention in class and they may become disruptive with their behaviors. And that's going to look like ADHD. But if you get formal academic testing, it will reveal a learning disability. And so if they get individualized attention and instruction, you may see those behaviors reduce. Next example, your child is more advanced than their peers. They finish their work very quickly and then they get bored and then they start becoming the class clown. They start disrupting the class because they're done with their work. Seems like ADHD because kids with ADHD tend to rush through their work, but usually kids with ADHD, when they rush through their work, they start to make mistakes because they're not very detail oriented. They're just rushing through it to get to the end. So they're not always paying attention to the details. If the behavior improves when you give the student more challenging work to occupy them, then you know that it isn't really ADHD. It's just that the work that they're being given is too easy for them and they're getting just kind of like restless. Third thing, some kids really are just immature for their age. It's not ADHD. And so sometimes it's helpful to meet with the child development specialist, like a psychiatrist or a psychologist, and they can help to sort out what's normative child development. Sometimes when kids are just immature for their age, they need changes to their environment. Like they might need a bit more structure, or they might be very sensitive to their environment. So if, for example, the teacher doesn't really have good control over the class and the class itself is very disruptive, then your child may artificially look like they're more disruptive. So sometimes it's just that they're lagging behind in normative development. And then the last thing I want to mention is stress. Okay, we forget that children absorb stress. So if there's stress at home, if there's stress in the community, if there's trauma, if there's loss, the child will go to school and they'll be physically in class, but their mind will be traveling back to all the things that they're worried about. And they're going to seem very inattentive. And they may respond to their stress with irritability, anger, or just overly silly behavior because they have all these feelings and they just don't know how to process it. And that could look like ADHD, but it might be stress or trauma. Sometimes it's both trauma and ADHD. Again, that requires a specialist to sort out. The problem is that sometimes families are not upfront about the stressors that their children have at home. So what happens is that they bring their child to see the psychiatrist and their child gets diagnosed with ADHD at age 6. Then later on, when they're like age 12, we find out that there was actually domestic violence going on in the home. And maybe that's why they were having problems with attention and behavior, but nobody wanted to disclose at that time that domestic violence was going on and maybe didn't really consider that this could have been, you know, part of the reason for why the child was acting the way they were acting. And, you know, in that point, we kind of think, well, was the medication even necessary? Was the diagnosis correct? Because there are actually a lot of other things happening. So it's a lot to think about, a lot to kind of work through. ADHD can be inherited from a parent. So it's not uncommon that after I've diagnosed ADHD in a child, then I realize the parent seems to be having difficulty keeping track of appointments, and they don't seem to realize their child needs a refill of the medication until they're completely out for 3 days. And then you realize maybe the parent also has a touch of ADHD as well. So it can be inherited. And that's sometimes something that's, I remember when I used to do more work with adults and I used to diagnose adult ADHD. And that sometimes what would happen is that, the parent would come because they say my child was recently diagnosed with ADHD and their psychiatrist told me I needed to get evaluated. So, that's something that could be helpful to look into. If you're an adult and you think you might have ADHD, as I said, there are a bit more barriers to getting diagnosed with ADHD as an adult. Often, it will require you maybe paying out of pocket to do a full psychological assessment, which can be a few $1,000s. You may need to do a full psychological assessment to prove that you really do have ADHD. And because, unfortunately, you don't have the kind of support that children might have with school and teachers and all of that. And it looks a bit different in adults too. So you have to make sure you see the right person. Some people will flat out say that they don't treat ADHD. So you may have to kind of screen providers before you see them to kind of say, this is what you're looking for as an ADHD assessment. No, don't say that you're looking for a specific medication. Just say that you're looking for an assessment, and then also maybe look into getting a full psychological assessment so that you have some diagnostic clarity from that as well. But yeah, it's just there's a bit more roadblocks to being diagnosed as an adult. But in any case, this is about ADHD in kids. If you want to have your child assessed and treated for ADHD, have them see a psychiatrist. Your local pediatrician can also prescribe ADHD medication. And you might want to talk to your child's school about having an accommodations plan. And with an accommodations plan, here it's called a 504 accommodations plan. You can ask for things like a little extra time to complete homework, or a little extra time to complete tests, or the ability to do tests in a quiet area with less distractions, things like that, that you can, see if the school can help you out with to give your child a bit more of a chance. So that's it for my show today. That's all I had. Let me know if you have questions about ADHD. Thanks for joining me this week for Black Mental Health Matters. I'm going to take a short break next week. I will see you again in 2 weeks, and I will talk to you soon. So take care.